Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jen Dusablon, your host for today's show. Franklin County Home Health Agency has been providing high-quality home health care and hospice to people of all ages throughout Franklin County since 1969. We are happy to bring you this monthly show to share information about our agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. On today's program, we'll be discussing Alzheimer's disease and related dementias. Alzheimer's disease and dementia are certainly areas that many of our staff are familiar with, having cared for many individuals and their families. And we feel that with the growing population, the growing aging population, it is increasingly important to share information about the awareness of this disease and resources available in our community and our state. So with me to talk about this today are two guests, one from the Alzheimer's Association of Vermont, Jessie Cornell. Thank you for being
Jennifer,
here.
thank you for having me.
Thank you. And one of our own from Franklin County Home Health Agency on our medical social work staff, Amanda Wilson. Thank you for being here again.
Thank you for having me.
So if you would just start off a little bit, share us some information about yourself and your role at the Alzheimer's Association.
Sure, thank you, Jennifer. So my name is Jessie Cornell, as you indicated. I have my master's degree in social work, which really puts me in a unique place to do a lot of community outreach. And in fact, that is what my title would be at the association. I've been with the Vermont chapter for going on 8 months now, but I've been with the Alzheimer's Association nearly 2.5 years. So we do a great number of things, one of which is education and awareness for the disease and the supports that we have. So it's really wonderful opportunity to be here to talk more about that.
Thank you. I'm glad you're here. And Amanda, a little bit about yourself and home health.
Sure. I have worked in the medical social work field for about 5 years, with home health for just over a year. I just hit my year anniversary, and it's been a really great organization to work for.
Great, thank you. Thank you both again for being here. So Alzheimer's disease is something that hits home for me. My grandmother did have that and died a couple years ago. So I know the impact on an individual family, and certainly many of our viewers, I'm sure, can relate to that. Can you talk about the impact of Alzheimer's disease and related dementia in our community and in our nation now?
Sure, Jennifer. I'm sorry that your family had to go through that, but I'm sure there were some positive points in that it may have brought you closer to one another and created new communication strategies that you didn't have before. As you indicated, we really need to be taking a look at this disease process because it's become more of a public health issue than I would even say an aging issue. With over 5 million Americans living with Alzheimer's disease, we've got to do something to change the projected rate of this disease process. Every 67 seconds someone develops Alzheimer's disease, and here in Vermont alone, well over 11,500 Vermonters are living with Alzheimer's. And that's over 30,000 caregivers in Vermont alone, because we estimate almost 2 caregivers per person's living with the disease.
That sounds like epidemic proportions.
We've definitely reached epidemic levels.
So what systems or what's in place to address this concern for the community?
We're really fortunate with the Alzheimer's Association leading the way in terms of advocacy, both at a state and a federal level. We're really quite blessed to be moving policy forward and seeing research shifted earlier into the disease process to find a cure instead of paying for care later. But we're blessed in this community to have agencies like Franklin Home Health and Northwest Medical Center to support us in terms of providing our education. We have amazing volunteers like Amanda herself, who is out there giving live presentations, it seems like day and night, to train folks in the community about what to expect with the disease and how to respond.
Yeah. So tell us about that, Amanda. In addition to the work you do at Franklin County Home Health as a social worker, Jessie's mentioning this education that you do for the Alzheimer's Association.
Yeah, I'm a volunteer community educator for the Alzheimer's Association. So what that means is I've been given training opportunities and resources from the Alzheimer's Association that I can present to professionals and just community members. I would need both hands to count the amount that I've done so far this year. Presenting at the hospital on dementia the basics, and some trainings for caregivers of people at different stages of the disease process. They've been really well received. I've trained some staff up at some of the assisted livings, and even our staff, our rehab staff, our care attendant staff, and our LNA staff have all had the dementia trainings that I can provide.
We're lucky to have the expertise come and share more with our staff.
Yeah,
Thank you.
It's really helpful.
How would other organizations in the community, as you mentioned, you've been able to do this in some community settings, how would they reach you to find out information about this program?
They could call me directly at Home Health at the 527-7531, or they could reach out to the Alzheimer's Association if they wanted to talk about specific training needs that they had.
Sure. Okay.
Yeah.
Thank you. That's incredible. So back to the vision of Alzheimer's Association. Share with us what that vision is and how we make that a reality.
So the Alzheimer's Association has what's called a three-pronged mission. So we're looking to enhance care and support for those currently living with the disease, but also to find a cure. You know, research is so crucial, and through things like our Walk to End Alzheimer's, which is our biggest fundraiser, that is going to fuel our mission and our vision, which is a world without Alzheimer's.
Okay. When is the walk with
Sunday, September 21st. It's at Shelburne Museum, so participation means that you get a full free day pass at the museum, and we do hope, of course, that it being our biggest fundraiser, that you'll also fundraise along that line as well. But it's a beautiful day filled with hope and empowerment, so highly encourage you to attend.
What a beautiful location to have a walk. That sounds nice. And you were just part of a fundraising event as well, right? Can you tell us about that?
It was called The Longest Day, and it took place on June 21st, which is the summer solstice, the longest day of the year. Here in Franklin County, we had just a day of fitness-related events. We took the framework of a healthy mind and a healthy body, and the relationship between, you know, having a healthy heart and good overall health and, you know, good brain health. And we raised our biggest fundraising event was a spin-a-thon that Duke's Fitness Center hosted for us, and we raised over $1,300.
Wow, that's excellent.
That's amazing.
Yeah, that's super. So talk about some of those, so people can help out by fundraising for you or just learning more so they can be better prepared to assist their loved ones when if they find they're in this situation. What kind of care and support, you mentioned, is one of the prongs of making this world without Alzheimer's a reality. What kind of care and support is in place for these individuals? Are there call lines or support groups?
Absolutely. I think the most important resource that I could share, besides Amanda, of course, is our 24-hour helpline. Anything under the sun dementia-related can be addressed by dialing this number. You have free access to a master's level care clinician who's a staff member trained and is a dementia expert to help us plan from logistics to responding through positive communication and effective care provision, anything from brainstorming on how to provide bathing without a battle to strategies for the caregiver to decrease social isolation and increase their quality of life, as well as the person living with the disease.
So anything under the sun. Any questions that might come up if you're caring for someone?
You know, I think the top three questions we hear are, you know, Dad won't stop driving and I don't know how to respond to that, or when is it time for my loved one to no longer be living independently? And the third usually focuses around the emotional toll that the caregiving provides. But I did want to point out that our 24-hour helpline is designed for not only community members and family members, but professionals and paraprofessionals as well. And also for people living with the disease. We're looking to reach out more and more to people just diagnosed, living in the early stages, that have a lot of questions about what that diagnosis means.
So their own self, they can call and ask questions about what this means for them.
Absolutely.
Sure. So let's talk about that early diagnosis and the benefits of being diagnosed early with Alzheimer's disease.
Sure. You know, being diagnosed early is very difficult for many people, but a lot of times people have a significant awareness of the challenges that they're facing themselves. So it's sort of our role to open that door and give them a safe, comfortable place to talk about the changes they're seeing in themselves, or to talk about the changes we're observing in someone else. So whether you're a family member or someone from home health, you know, having that dialogue and creating that comfortable space to then share those concerns with the physician. But an early diagnosis allows for greater independence. It seems counterintuitive, but that is the case because we can put the right supports into place to maintain independence and dignity. We can put our legal and financial plans into place using our own voice, not what somebody is trying to figure out what we would like if that conversation doesn't take place early enough. It also allows you to get connected to other people. You know, we often see depression and isolation start to happen to folks in that early stage, both their care partners and the person. And what we found is that by talking about it early on will help bolster your existing social network and get you connected to people also living in the early stages.
It sounds like you're talking a lot about decreasing the stigma that might exist with the dementia.
Absolutely.
So you're letting people know it's safe. If you have questions, you can talk about them. There are resources available to you.
And then it's not your fault.
Yeah,
you know.
thank
And if you asked earlier, what can we do, and what is our mission, and how might we help that mission? And I think talking about it is the number one thing that we can do to help decrease that stigma, and then start moving not only our government towards funding for a cure, but also helping us create a system across the state of Vermont that can handle the influx of the diagnosis. So talking about it is absolutely essential.
Okay, excellent. And so as a social worker in home care, she mentioned how a lot of things that come up, financial, family, overwhelming feelings from family. Talk about what you've seen caring for someone with dementia. How do you help the family get through?
Yeah, caring for someone with dementia or Alzheimer's disease, it's really caring for the whole family, and it's a big family system, all the way from the spouse to the children and grandchildren, how they're all impacted by the disease and the changes. It's a grieving process. So I think a lot of what we do is that supportive counseling and that grief work with people ongoing. The early diagnosis is so important. We do a lot of the advanced care planning and long-term planning decision making, talking about, when you do need care, would you rather have people in your home, or would you want to go to a long-term care facility? What type of facility is important to you? Giving people the empowerment to make those decisions ahead of time is really important, and we do a lot of that. Also, connecting people to the resources, giving them the information on the hotline, on the support groups that are available to them in the area, telling them about some of the online resources that are out there that can help them. It really gives them a sense that they're not alone, and just staying connected to us at Home Health. Recently, I've been collaborating more with our speech and language pathologist because they can do quite a bit of cognitive assessment. Then we gather a lot of information and can share that to the doctor and help with that early diagnosis.
So there you go, talking about that collaboration with all the care providers. So if you're questioning what's happening with this individual, you're talking to a doctor, you're talking to the family member, you're getting all sides of the story, and you're helping to put that together. That's good.
Yeah.
Can you both mentioned the hotline a couple times. Can somebody tell me what the hotline number is, and they can put it on the screen?
Absolutely. Our 24-hour helpline is 800-272-3900. And on staff, night or day, are dementia care experts that will speak with you free of charge and confidentially about any concerns or questions you may have.
That's excellent. So we'll be sure to share that online as well. We'll have a link to that on our website. You also mentioned the support group. Can you talk about locally what we have available for support groups?
Through Home Health, we have a support group. It's a caregiver support group, and that's for caregivers of people of any chronic illnesses. And there's also another support group. It's a memory cafe here locally in St. Albans, and information about those groups can be found on the website for the Alzheimer's Association.
Excellent. We're really fortunate to have all these wonderful resources available to us. Talk about other ways the community can help move the mission forward.
Absolutely. I just wanted to point out too that we have a telephone-based support group for both caregivers as well as persons in the early stage. So just dialing that 800-272-3900 will get you in touch with those resources, so we can help you learn a little bit more about that.
So there's a hotline, but there's also one where you kind of a group discussion on the phone?
For the caregivers, we meet monthly, the first Monday of each month over the telephone. You would just give us a call, let us know you're interested, and we'll provide you with the appropriate number and dial in information. And then for the persons with the early stage, we meet weekly for about a 45-minute telephone call.
Very cool.
Yeah, we just finished up our first pilot of that, and it was phenomenally successful.
Yeah, because getting out isn't always easy for everybody.
No, transportation can be an issue, and sometimes it's just, especially when you're starting to talk about something new to yourself, it's a little bit more comfortable to be at home. So it was a phenomenal response from the 8 participants, and we're really pleased to see how that has bloomed.
That's great. That's really cool. I like that. Anything else you'd like to share with us today about?
I think accessing our website is really helpful. If you
Can you tell us the website address?
Yep, it's www.alz.org. Visiting will get you connected to a brain tour to help you learn about the 10 warning signs of the disease process, a whole caregivers resource center, an entire web page devoted to people living in the early stage has just been created. So it's a great one-stop shop for just about anything you would need to learn. But always contact us if you're struggling to find something. 800-272-3900.
Thank you for repeating that, yes. Now I know it's a very broad topic to cover right now, but can we just touch a little bit on those stages? You keep mentioning early stage. You're doing a lot of the education. Can you briefly tell us what the stages are and what differentiates them?
Sure. When we talk about people in the early stages, the kind of hallmark for the early stage is the recent memory loss. Someone's going to be having some short-term memory loss. They'll probably have some more difficulty with money management, you know, not paying their bills and not keeping track of their checkbook like they once did. Probably some of those driving difficulties, the small accidents are happening in the early stages. The middle stages, I feel, are kind of hallmarked by someone in the early stages probably needs supervision. They need some reminders and some verbal cues throughout their day. Someone in the middle stages is probably needing hands-on care at that point. So it's not just a reminder to brush their teeth or comb their hair. They're needing some physical help with those things, with putting their clothes on, help in the bathroom maybe. The memory loss is more. Their long-term memory is affected as well. And then when someone moves into the late stages of Alzheimer's or other related dementias, they're probably having more difficulty swallowing, difficulty with ambulation, with moving around. They may be bedbound. Both short and long-term memory are affected. They're likely not recognizing their family members. So they're needing 24-hour around-the-clock care at that time, which is really hard to provide. But luckily, with a lot of the systems that we have in place in Vermont, with home health services, with the Choices for Care program,
there's some respite and other
respite, hospice, even at those late stages, we can help keep people at home for a really long time. Yeah.
Where they're in such a situation where their surroundings could be so important to somebody who is confused. I can imagine being at home versus being in the institution might be helpful for them.
Yeah, routine is so important, and when you think about your memories and kind of storing them back in the brain, you know, the more that you experience something in a routine, you kind of think of it being pushed back. And those are the memories that are kept the longest for somebody with Alzheimer's or other dementias. So the routine is really important, and every time you disrupt that routine, you really disrupt the person's daily life. So the more we can keep people at home in familiar settings, the more successful their quality of life tends to be.
Right, that's important. And you mentioned so many things where I can see different disciplines at home health being able to help out, whether it's, like you said, speech therapy you're working with, occupational therapy or physical therapy, helping people physically find new ways to do things for their loved one or for themselves. So it's a good team.
There's a lot that we can do to keep people safe and have that quality of life and dignity. You know, when part of the brain is affected, the balance, and people are actually falling because of Alzheimer's disease. That's truly what's happening. So when we can get therapies involved and figure out strategies and safety recommendations for the house to make them more successful, it keeps people healthy and at home and out of the hospital for longer.
And for the caregiver as well. I mean, you raised such a good point. As we move into that later stage and more hands-on care is needed to be provided, it's really important that the caregiver themselves learn how to physically provide that care and keep their back strong and you know, not pull their own muscles. And it's important to recognize that a lot of caregivers undergo emotional stress, which we often recognize, but physical stress as well. So what a great team that you've got in place to give that full care.
Yep, excellent, good. Well, thank you both for sharing this. This is wonderful resources, the Alzheimer's Association website, the hotline number, the caregiver support groups, Amanda here locally, a wonderful resource, and we thank you for taking the time today to share with us and for all that you do in Vermont and for this condition. It's so important. Thank you. So anything else you'd like to share before we close today?
No, thank you so much for the opportunity.
Thank you. Thank you both. And I just want to remind our viewers that Franklin County Home Health Agency is also doing fundraising this year. We are planning for our 6th annual Blue Jean Ball this fall, and part of that is our quilt raffle that is taking a tour this summer. So keep your eye out at local farmers markets and shops and summer events for that, and support Franklin County Home Health Agency. We thank you for taking the time to watch today, and you can find this on Channel 15 as well as on our website. You can see it again and find all the resources that we talked about today. So thank you for watching, and be well.